Good morning, dear students. We'll be seeing about how to insert NG tube in this procedure. We'll have separate video for removal and also for feeding. Okay. So as we all know, the regular procedure, first you check for the doctor's order. The doctor's order says we need to start feeding for this patient, NG tube feeding. This patient has got some swallowing difficulty, dysphagia. So we are going to insert a tube through the nose into his stomach so that we can use it for feeding. Okay, so good morning sir, how are you? And I am your nurse today. My name is Jansi. I want to do some procedures on you. Before that, can you please tell me your full name?
Muhammad Ali, Muhammad Ali.
Okay, can I check your ID badge please?
Yes.
Muhammad Ali 01285. Okay, I know you have some difficulty in swallowing. So the doctor has ordered for us to start you with NG tube feed. Okay, it is a tube which we will be introducing through your nose and into your stomach. Little discomfort will be there, but don't worry, we'll be helping you. We'll give you some instructions and then you can have it in an easy way. Okay, now what are all the things we are going to assess before we put the NG tube into the patient's nose? Okay, I want to check whether patient is able to cooperate, patient is able to understand what I say. Okay, patient is conscious, so he can understand, he can cooperate with me. Now his nose, whether he had undergone any nasal surgery? No. If he has deviated nasal septum. Deviated nasal septum means maybe some injury they had when they were small. It could have moved the septum of the nose to one side. So you see which nose is better for us to use. He does not have such problem. And I checked his medication records. He is not on any anticoagulants because it can cause injury and bleeding. So I should be cautious about it. And then his gag reflex, his swallowing ability is lesser. So I need to be careful when I am inserting. If he can gag or not, I am not sure about it. So I have to be little careful about it. Okay sir, you are fine. I will go and prepare my equipments and get back to you. So when I come, what are all the things I need? Okay, this is called NG tube. Okay, this is nasogastric tube. For feeding we are going to use it. And I need little Vaseline just to facilitate inserting it. I need a stethoscope. I need info sheet. I need to have micropore. Okay, if I continue to if I am going to feed the patient continuously, let me prepare all the feeds. Okay, these are all the feeds which I need to prepare. I need to check his pH, the stomach contents pH. So I have taken a pH strip in a container, and to read I have this checklist. And also I need to take the 50 ml syringe. This syringe you will find it for the first time. This syringe is not for giving any injection. You cannot fix the needle over here. This is called feeding syringe. And of course I need keeping tray. I need to have my hand hygiene also. Okay. How are you sir? I'm back.
Okay, good.
Shall we go ahead with the procedure? Okay, first of all you should remember that we are going to position the patient. There are two positions which you should keep in mind. Okay, first I will be putting the patient in high Fowler's position. You know what is high Fowler's position? It is raising the head end of the patient as much as possible. It's almost like sitting. So if the patient is conscious, we can even make them sit. Okay. Sir, now when I am going to put the tube, okay, first you will have to hyperextend your neck. That is like this. Okay, till I reach the throat. After I reach your throat, you will have to flex your neck and swallow. Okay, then it is easy for you to for us to facilitate the tube into your stomach. Okay, so these two instructions please remember. I have kept water for you. Okay, in between when you want to drink and swallow, it will facilitate us to put the tube inside very easily. Okay, you can ask me. Of course I need my gloves. Okay. Before we start the procedure, we have given all the instructions. We have positioned the patient. Now we are going to measure how much of the tube should be inserted inside my patient's stomach. So how do we determine that? Okay. Keep like pushing. Going to open the tube and I am going to measure how much of the tube should be inserted inside. How do we measure it? Okay. This is the tip of the tube. The tip of the tube should be in the tip of the nose. Okay. Then you go up to the earlobes. Okay. Tip of the earlobe. Then the same tube you come up to the Ziffy sternum or xiphoid sternum. Okay. This is how we measure it. After I measure, let me mark it. Okay. This is 45 centimeter. So just add 5 centimeter to it. So how much I am going to insert inside? I will be inserting 50 centimeter of this tube. Okay. Keep it with you. You need to apply little bit of the Vaseline. Ideally it should be the jelly which should be applied, because for the mannequins we don't have it, that's why we are applying this. Okay. So apply this and keep, sir, you can have a tissue in your hand. Okay. If it is the real patient, you give a tissue and water also, so that in between when we are asking him to swallow, he can swallow it. Shall we go ahead with the procedure, sir? Are you okay?
Okay.
Okay. Roll the rest of the tube in your hand so that it's not hanging down. Okay. First he is hyperextending the neck. Okay. So I prefer to do it in the left nostrils first. So as I keep advancing, when it reaches the throat, I can feel some resistance. Okay. So let me check, sir, can you open your mouth? Okay. I should check whether it is coiling inside the throat. It is not. Can you flex your neck and can you swallow? Okay. As he is swallowing, it is very easy for me to go inside. Okay. Till where I should go? I should be reaching up to 50 centimeters. Okay. Now I have reached 50 centimeters. The moment you are inside, you do not want to push any air inside. So we have a cover. Okay, this is the cap. Okay, whenever you insert the tube, immediately remember to put the cap. Otherwise, there will be a lot of air. The patient will be ingesting and it can cause gastric distension. Okay. Now we are going to do few checks. What are the checks we are going to do? How do we know that this gastric tube is there in the stomach? So there are few ways of identifying it. The first one is when you are inserting itself. If it had gone into the lungs, then the patient will be coughing and sneezing and gagging, and he will not allow you to insert it at all. Now our patient is comfortable. So this is the first indication that it has gone into the stomach. Now we want to know exactly whether it is in the stomach or not. Okay. So the first test is, I want to take 10 to 30 ml. How much ever you want, you can take 10 to 30 ml of air. Okay, I have cleaned my stethoscope already. And I will be keeping my stethoscope in the epigastric region. Okay, epigastric region. So when I push air, I should be able to hear whooshing sound. Whooshing sound is nothing but air passing inside the stomach. Okay. Open. Whenever you open, try to pinch the tube. What is the reason? We do not want any air to go inside unnecessarily. Okay. When I am pushing, I could hear the whooshing sound very clearly. So second indication that it is there in the stomach. Okay, I have one more way of checking it. What is the third way of checking? I am going to withdraw some amount of gastric juice. Okay. sometimes when we do for the first time, we may not get any gastric juice. Okay, so if you are taking very little amount, just 2-3 ml will be enough for you. Okay, you pour it over. See, I have the pH strip, pouring it over that. Close it. Now I am checking the pH. Okay, the color of the strip, the change in the color of the strip says that the pH is 3. Okay, we know that the gastric contents are acidic. So if it is up to 6, okay, usually it is 2 to 6. Because it is 3, I know it is there in the stomach. If it is 6 and above, mostly 6 and above will be duodenal juice. So maybe you have gone more into the duodenum. 7 and above, you should be doubtful whether it is in the lungs. Okay, so we have to be careful. So what are all the ways we have confirmed? Patient is comfortable. Second thing, we have pushed air and whooshing sound we could hear in the epigastric region. Third thing, pH is within 6. So we know it is acidic, it is gastric contents. After you make sure about all these 3 things, now we are going to fix the tube. Okay, we have micropore tapes. Okay, prefer to do it without gloves. There are different ways of fixing it. Okay, this is the best way. You take a micropore, divide it into 2. Don't divide the upper portion. Okay, so fix the upper portion on the nose bridge. There are 2 tails which we have taken. So take one of the tails around the tube and fix it on one nose, and cross the other tail, put it on the other nose. Okay, and one more strip you take like this, fix it on the NG tube, close it. Okay,